This journal club presentation is based on endometriosis. It occurs when tissue similar to the endometrium is located outside the uterus, typically on other pelvic organs. These tissues act like those in the uterus and with every menstrual cycle will thicken, break down and bleed. This process causes pain and inflammation as the displaced tissue cannot exit the body. It often leads to a build-up in scar tissue and development of cysts. A major issue associated with the condition is that diagnosis can often be delayed by 7 to 10 years. This is as a symptom of pain in the pelvic region during menstruation is often accepted as the norm. Laparoscopy is currently the only method that can detect displaced endometrial tissue and thus diagnose those who have not developed cysts. However, this is a surgical procedure and therefore comes with the risks including damage to blood vessels, the bladder and uterus. This issue surrounding diagnosis has been recognised, and research into possible biomarkers has begun. A biomarker is an objective, quantifiable characteristic of biological processes. This paper, Peripheral Biomarkers of Endometriosis, a systematic review, was produced in response to this issue. The systematic review has collected information and data based around the question, does a biomarker or panel of biomarkers exist that could be used as a tool to diagnose endometriosis without the need for surgery? This paper used Quadras criteria to perform a systematic review of the literature. The search was limited to the past 25 years and critically assessed the clinical value of all proposed biomarkers for endometriosis in serum, plasma and urine. A primary computerized search was performed through these databases and used these keywords. They also limited the publications to those written in English. Data including the sample size, biomarkers evaluated, and tissues sampled was extracted from the selected studies. Over 100 potential biomarkers were identified under these topics. However, the review was unable to identify a single biomarker or panel of biomarkers that have shown to be clinically useful, as many studies had conflicting results. There were 50 investigations, however, that reported a correlation between CA125 and endometriosis. This correlation has been used in studies to monitor the treatment and seems promising, however still requires further investigation. This review is limited as the wide range of studies included used different methods, recruitment strategies, study designs and different patients as controls. These factors would have contributed to some of the conflicting results. The type of endometriosis could have also had an impact on the biomarkers present, which would need to be taken into account for future research. The review was also limited to papers in English. This systematic review is of high significance as it has highlighted that some potential biomarkers in areas where future research is necessary. Due to this, a focus of the future should be to use this data to investigate the identified biomarkers further so that one day diagnosis of endometriosis may be safer and more efficient.